So now, on the floor, we order a lot of tests, and these tests come out of what we call the Non-Invasive Vascular Laboratory. And that's in our hospital here. It's on the fourth floor. You guys know I like text Danny, patients, Derek, Tracy, Jessica. Okay, and a couple of them are here. You guys raise your hand. Maybe one. Okay, so this is Danny Baker, but he's been here the longest. So this is the Non-Invasive Vascular Lab. The Non-Invasive Vascular Lab has been called a lot of things. They're called Doppler studies. They're called duplex. In the old days, they were called flow studies. It can entail studying the veins and the arteries, the arms, leg, abdomen, and neck. Examples are in the neck, we'd be studying the carotid arteries, jugular veins. In the abdomen, we'd be studying the aorta, the vena cava. The legs, they use the Doppler studies to pick up DVT by evaluating the veins, and then also looking at arterial blood flow in the legs. This is a picture of Doppler. He was an Austrian physicist back in the 1800s. And what he did was he identified that if sound is traveling at a certain speed and you have a fixed point, so like if I'm standing here, and the helicopter and the fire engines are examples, if I'm standing here, a helicopter flies over, if the helicopter's here, it sounds one way, and as you think about it, when it goes past you, the sound changes. And the same thing for a train or the siren or fire engine. That's called, we won't go into a lot, but that's called frequency shift. And that is defined as the Doppler effect, that sound will change with motion at a fixed point. And that's probably all you need to know about it. So this just depicts that this is a probe here that you guys use on the floor, maybe to check Doppler's pulses. And so what happens here in this probe, if you look at the probe, there's a little thing in there called a piezoelectric crystalloid, which detects blood flow coming towards that probe. And it detects it based on charged particles going past this. So then it goes into the probe, and there's a lot of business that goes on within the Doppler unit that sound is created. Well, it's that flow coming past that Doppler probe that gives you that little that you hear on the floor when you put your Doppler on the artery. So that's the Doppler effect. Now, the vascular lab we use for all kinds of things. Like we said, we use it for checking arteries in the neck. In this instance, this is depicting someone undergoing a carotid artery. So this is the carotid artery in the neck. This is the probe, but they call it a wand. This is probably a lot more sophisticated than the one that you guys are using on the phone, on the floor. But the mechanism or the philosophy behind it is the same. Charged blood cells are coming past this probe. They're picking up the flow. It goes through. Computer does this thing called fast forward analysis and then gives us information back. And so this is how when you see someone that says carotid duplex, carotid Doppler, whatever, this is what's going on, and this is how that's done. So now, people sometimes confuse it. We have what's called Doppler, which is the sound portion of what we hear. You guys are hearing that on the floor. But then we also have ultrasound. So now, when we order, or when I order, or anyone orders, we order in what's called a duplex scan. So duplex just means two. So what's happening actually is that we're taking Doppler, when you hear the sound, combined with ultrasound real time. It's like when you have babies or gallbladder or whatever, you get the ultrasound probe, it goes there, the sound wave goes across the medium, bounces back, and gives images. So we have two things for one, so we call a duplex scan. So we do duplexes of the neck, the belly, the legs, the feet. And so people sometimes will say, we'll get a Doppler. Well, a Doppler is really not a duplex. A duplex includes Doppler and what we call real-time ultrasound imaging, which is here. This is what the scanners look like. You guys have probably seen them bring them to the floor. As I said, we scan neck, arms, legs, and abdomen, and that's just the duplex scan machine. Next, we talked about Doppler. Doppler gives us different information. As we said, we check the wave, we check the flow, but also with that flow, there's a generated arterial waveform. That arterial waveform, based on the morphology of it, tells us the presence or absence of disease. So a good example here, as you can see, this is a nice, what we call triphasic waveform, up, down, up. The same artery on the other side is really flattened, which demonstrates that the blood flow is markedly reduced there. So that's what Dopplers give us, and we get the Dopplers of the arms and the legs. Sometimes we order what's called ankle brachial indices, meaning they just take the pressure in the arm, pressure in the leg, and take a ratio. But a lot of times we'll check upper extremity Dopplers, lower extremity Dopplers. That's called segmental pressures, where the cuff is placed at various levels. Here, here, here. And we look for a drop, let's say for instance, between this and this. And if that happens, then that means we have a block or something's compromising blood flow here. The other thing that we do is we'll take pressure in both arms. If there's more than a 10% or 10 millimeter difference in pressure, then that would suggest that there's a blockage on that artery where the pressure is the lowest. So if we have a systolic pressure of 130 here, 110 here, that's a 20 millimeter gradient between the arms. So that would suggest that there's a problem with what we call the arterial inflow to the left arm. And so this is, I just said what we can do on the arms, we do on the legs. This is just another demonstration. When we ordered the studies, cuffs are placed here, here, and here. There's a cuff on the arm. We take the arm pressure. The ratio between the arm and the thigh should be 1. It should be equal or greater than 1. But if there's, let's say for instance, if the ratio is 0.7 or 70%, that means there's a narrowing somewhere. And based on where these cuffs are placed, that will give us an idea of what the narrowing is or the blockage is. All right, so now we'll get into anybody have any questions? If you have some, stop me and ask me. I just wanted to give some fundamentals on what we're going to be hearing a lot of here in a second.